Welcome back to Module 4 for dealing with HIV/AIDS in your new venture. Today's module we're going to be looking at supporting workers with HIV/AIDS. And here are the module outcomes for today. Firstly, access to a company policy on HIV/AIDS or National Department of Health documents, which is guidelines for developing a workplace policy and program and providing evidence of knowledge in the form of a brief summary. Listen the possible problems that a worker with HIV/AIDS could encounter with suggestions as to what the learner themselves could do to create a caring situation in the workplace, as well as describe the importance of employers playing a proactive role in addressing the AIDS epidemic and suggest ways in which a company can create a caring environment for workers with HIV/AIDS for familiar context. Knowing what guidelines and assistance are available to support workers with HIV/AIDS. From a legal point of view, there are a number of laws and guidelines related to people who have HIV/AIDS in the workplace. The most important of these is that the HIV-positive employer has the same rights and duties as any other employee. An HIV-positive employee may not be treated differently by his or her employers or by his or her colleagues. Understanding the company policies and guidelines. There are a number of guidelines and assistance available to the organization to support workers with HIV/AIDS, such as the company policy on HIV/AIDS or the National Department of Health's document called Guidelines for Developing a Workplace Policy and Program. Another document that is quite valuable is the Code of Good Practice on Aspects of HIV/AIDS Employment, developed by the CCMA. The Code of Good Practice on Aspects of HIV/AIDS Employment. Eliminating unfair discrimination in the workplaces based on HIV status. Promoting a non-discriminatory workplace in which people living with HIV or AIDS are able to be open about their HIV status without fear of stigma or rejection. Promoting appropriate and effective ways of managing HIV in the workplace. Creating a balance between the rights as well as responsibilities of all parties. Giving effect to the regional obligations of the Republic as a member of the South African development community. Possible problems that a worker or HIV/AIDS could encounter. Employees who are affected with HIV may face stigma and discrimination from co-workers in the workplace, usually due to the ignorance and misunderstandings of the ways of which transmission of HIV. We need to treat all our colleagues with respect and dignity, whether they are HIV positive or not, or even whether we suspect they are HIV positive or not. The importance of employers playing a proactive role in addressing the AIDS pandemic. It's important that employers' organizations play a proactive role in addressing the AIDS pandemic and in creating a caring environment for workers with HIV/AIDS. Those patients who work for large corporations with good HIV/AIDS policies may receive treatment from their employers or from private health providers paid through the company's health insurance schemes. The availability of HIV/AIDS prevention and wellness programs. There are many HIV/AIDS prevention and wellness programs provided by medical schemes, organizations, and other bodies. You need to find out about these to ensure that you have the knowledge to share with others if and when they need it. Anyone who has concerns arising from HIV/AIDS can phone the AIDS hotline on 0800 012 322. The treatment options available to a person with HIV/AIDS. Research into HIV/AIDS is ongoing, and new information is emerging rapidly. There are drugs that can dramatically slow down the disease in an infected person. Up until recently, these drugs had to be taken in various combinations in order to be effective, and so the treatment was generally quite expensive. Antiretrovirals can slow down the rate at which the virus multiplies. The rights of all workers in respect of HIV/AIDS. No person with HIV or AIDS shall be unfairly discriminated against within the employment relationship or within any employment policies or practices, including with regard to examples: recruitment, procedures, advertising and selection criteria, appointments and the appointment process, which includes job placement, job classification or grading, remuneration, employment benefits, and terms and conditions of employment. Universal precautions. Universal precautions means treating all blood and other body fluids as if they were infected with HIV. Universal precautions include washing your hands between each patient or each task, after using the bathroom, after taking off your gloves, wearing gloves when you touch blood or any other body fluids, wearing a gown, a mask, or eye protection when you may be splashed with blood or any other body fluids. Draft code of behavior in the workplace and presenting. The code should cover two main areas. Firstly, it should aim to help someone to cope with the realization that he or she has HIV/AIDS. Secondly, it should provide information that would prevent someone who does not have HIV/AIDS from becoming infected. And obviously this would be important if you are starting up your new venture to actually have this code in place. Please complete class activity 4 in your workbook. Thank you.